75% at least of our patients are seniors and or supporting their caregivers. So the big difference for them is sort of the peace of mind of what they should do about the various problems they're encountering. And also for the caregivers to know what to react to, what is a problem or not. So it keeps them out of the emergency room, which is a quality of life issue. It keeps them in their home. To have a highly qualified nurse who goes to your home and assesses you, listens to your lungs, does a complete physical assessment so that they know whether they need to phone the doctor, perhaps to get a prescription or to let them know, to get their advice. This also helps people not have to go to medical appointments. In some cases, they need something done in the home every few months. And in the winter months, in some parts of Canada, that's difficult as well. So now you have a nurse who goes to the home to give the injection, to manage something that otherwise would have them leaving their home. So there's a number of ways that it's a game changer for people to have our support. I think a big piece is for the caregivers. There's a lot of chronic complex disease in our communities now, and the caregivers are shouldering the burden of that, and they're worried. Should I have done something? Should I do something? Is this something to worry about or not? Where they have a nurse they can call who really knows their family member, who can really give them this sage advice they're looking for, makes a world of difference for them. And let's remember that at this point in Ontario, we have plus or minus 30,000 people on the wait list for long-term care. So that means that the acuity of people in the community, that they are really struggling with a lot of health conditions. We have a healthcare system that is set up to deal very well with acute problems. But what we're seeing now is that primary care isn't what it could be in our communities, so people inevitably end up in the hospital when it's something that could have been dealt with in the community. So our service allows people to have a highly experienced professional actually seeing them in their home. And this is where really it makes a difference. We actually see what it is they're going through.